When is the best time for a person to get adjusted? It's a good question. And the way I explain that to my patients is by telling them that the most important adjustments you get are the ones when you're not in pain, which for someone who doesn't understand chiropractic and isn't striving for wellness might not make sense. But when you're only getting adjusted when you have pain, you're basically just trying to reduce a stimulus that's gotten so bad you can no longer compensate for it or subvert it with different neurological and anti-inflammatory mechanisms already in your body, which is still useful and still healthier and still safer than taking pain medication. But if you only get adjusted when you're in pain, chiropractic for you is pain management. Wellness is a lifestyle, wellness is continual. So to really get adjusted and say you're doing it for wellness would mean you're getting adjusted when you don't have pain, which breaks the whole concept of the insurance industry that chiropractic is for back pain and puts the onus on the patient to take responsibility for their health and to sometimes maybe go out of pocket for that responsibility. But, preventing sickness is far more cost effective than dealing with illness. So wellness would mean that you don't go more than a month without being adjusted. If you only get adjusted when it hurts, you're smart to use a natural, effective method to get rid of your pain. But you're not really practicing wellness, because with wellness care, as I explained it, you're going to continue to improve throughout that time frame. Maintenance care, which people sometimes call frequent chiropractic care, is the wrong term. Maintenance care is pretty much what you're doing when you only get adjusted in pain. You're maintaining a shitty condition, you're maintaining dysfunction, you're maintaining inflammation, and you're just getting treated to the point where you can now bear with it. There has to be some objective measure for when your function is improving. And when you fully get into wellness care and stay with it, the subjective component will reaffirm to you that you've done what you needed to do. To clarify this point a little more, I'll see some patients maybe once every 6 months, once every 3 months, 9 months, sporadically throughout the year. And they're always come in and talk about how they're dealing with this condition, and when it gets so bad, getting adjusted is the only thing that helps. And I do acupuncture and nutrition as well, so that this would apply to all the natural modalities out there. But primarily the chiropractic thing, when we're talking about these conditions, is what most people are coming through the door for. And a question is always like, oh man, what do I do? Is this the only thing that helps? I gotta get adjusted. It really helps. And it's mind blowing. You mean, what do you do? The thing you just told me what you're doing right now is the only thing that helps. Maybe try doing it a little more, right? So we're so programmed to think that there's got to be a diagnosis, there's got to be a test. What about an MRI? Well, if you got adjusted once and were good for 6 months, at least good enough that you felt you could go about your day and not have to address this pain, what would happen if you got adjusted more? How is more of a good thing not naturally something we already do? I've watched it happen for 20 years. I think the society's been programmed really well to just not understand what wellness is and how it's good for them. And even thinking that maybe there's some magical supplement that's going to set their nervous system straight. There isn't. There's ones that will help your nervous system function properly, but if you have distortions in your central nervous system and you don't get them adjusted out, they're there. And I always find it really puzzling to me. I'm certainly very biased and I see the world with chiropractic lenses, but the thing that fixed you is the thing you need to keep doing. So it's not the chiropractor telling you to keep coming, it's the chiropractic worked. Why would you not continue doing that? And why are you so blown away that once every 8 months it's the only thing that finally makes you feel better? So that's just an observation as a clinician I've seen. So, the thing that actually fixed your neck, maybe try doing it a little more. That's wellness, right? That sometimes it involves other modalities. The other point really important to make here is if you are undergoing wellness care, the patients I have, which are a good amount, who just get actual wellness care as I'm explaining it here, when they do have an incident, when they do get hurt, they get better very fast. Say a patient comes in off the street or someone I haven't seen in a year with an injury. If you've ever been into physical therapy or any kind of therapy program, you typically know it's a few days a week for about 4 to 6 weeks, and then you taper down, you go through that acute care, the tissue repair stage, 6 weeks, physiology to repair your tissue, right? that's pretty much the norm. What I see with people who get adjusted on a wellness level is they may fall down the stairs, they may fall skiing, they may lift something and really hurt their low back. And within a week, they're good. Maybe it's 2 adjustments and they're good and going because the nervous system has been properly maintained. They are well and they heal quick and it clears. When someone comes in with an injury and they haven't been treated previously, they've got all the dysfunction they've been carrying around for God knows how long on top of an injury that just started. So now you got to get rid of that injury. You got to get rid of all the underlying dysfunction. You got to train the nervous system, get the tissues moving. So ultimately, that person may see me in a 4 to 6 weeks period what someone doing wellness would have seen me in a year. So trying not to beat it to death, but chiropractic applied properly is wellness. Chiropractic applied only when you're in pain is a real good, healthy, natural alternative to drugs. But you're kind of selling yourself short when you only get adjusted when you're in pain. Thanks, guys. Be well.